right, guys, in this lesson, we're going to talk about inserting an IV in the bariatric patient. So one of the things that we want to look at are tips and tricks for these types of patients, because these are going to be very, very challenging patients, and it's for very good reason. One of the things that we have to remember is that bariatric patients have a lot of excessive tissue, and we have to make sure we get the right location when we're selecting that IV. Now, one of the things we want to consider are that hands are extremely difficult, and it's for several reasons. First off, you have the patient's hand, right? And you have all of these, the venous plexus, they're everywhere. But the problem is these veins, they're not straight, they're branched, they have a lot of valves, and then accompany that with the excessive tissue that bariatric patients do have, and sometimes peripheral edema that can make it really challenging. So if we can't go in the hands, or if we elect not to go to the hands, the next spot that we're going to go is the forearms and the AC, and the cubital fossa. And the reason we want to go here in bariatric patients is they have a greater area of success. While some patients will have that peripheral edema, one of the things we want to think about is that it's typically going to be easier to get these forearms and AC. Just remember, if you're doing the AC, you're gonna have a greater likelihood of bending that elbow. And because of that, we want to make sure that we educate our patient and make sure that it's like, hey, just remember, don't bend your elbow when it does, because it's going to occlude that IV, and then your alarm's going to go off, and they're not getting their therapy like they need. Now, a couple of other tips that you want to think about with the bariatric patient: you want to start low, meaning that we want to start as low as possible in the forearm. If this is the wrist, we want to start somewhere down in here. We want to avoid the joint. What we don't want is we don't want the end of that IV catheter ending at that joint, because like if it's a wrist or if it's an elbow, it's going to occlude. And the other thing is this idea of go bigger if necessary. And what I mean by that is, if you are going to put in an IV, and let's say you think you can get a 20, or you can get a 20, but you think you can get an 18 gauge, well, think about this. If there's a lot of excessive tissue, that 18 gauge, because it's bigger, is going to offer a lot more stability. So you can use that 18 gauge if you have a good likelihood of hitting it and you can get the 20. Sometimes you just have to go big or go home. So it's just something to keep in mind. So IV insertion, this is really important. You basically want to set up, you want to create the routine. You want to create a routine just like NBA players do when they come to the free throw line. You want to set up everything, you want to get it all ready to go, and you want to walk in. So this is just an outline very briefly about the things you need to do. You need to make sure you prep your supplies, get everything. You need your IV, you need your IV kit. Just make sure you have everything you need. You're going to need that extension set, and you're also going to need a flush. Just make sure everything is good to go. Set everything up, and make sure identify the vein. These things are going to happen somewhat simultaneously. You need to kind of be looking at your patient when you're doing your assessment, and then think about, hey, I need an IV. Which size am I going to use? Am I going to use 18, 20, 22? What am I going to do for this patient? So let's just think about that. And then get everything set up. You get your tourniquet, apply it. Your tourniquet is going to be in this IV kit. And then once you're all set, you prep it, use that ChlorPrep, place that IV with confidence. And then once you're done, get that thing secure. Now let's talk about the hand insertion. We're going to talk about several different ones. Today we're going to talk about the hand, we're going to talk about the forearm, we're going to talk about the AC, and we're also going to talk about the bicep and inserting it, and a couple of the nuances and little tips and tricks that you're going to see along the way. These are practical applications of doing this IV insertion in the bariatric patient. But if you absolutely have to go in the hand, the one thing you remember is you want to start low. You want to try to give yourself as much of an opportunity as possible. So if the wrist is down here and we're starting really high up on the hand, we know that this is going to end here. They're going to bend their elbow, and then you're going to have a bunch of occlusion problems. So just remember, try to start kind of near the knuckles is a good guideline. Just remember, they could be difficult sticks, and it's going to be to that excessive tissue. So let's take a look at a video. Now, the reason we want to show you this video is because we want to show the difficulties that you could face. Not everything is cupcakes, roses, and butterflies in nursing. It just absolutely isn't. You're never going to get every IV every time. It's just impractical. We're going to show you what happens if you miss. We want to be practical. We want to give you that practical knowledge that sets you up for a realistic approach to nursing. We want you to be optimistic. We want you to be confident. We want you to walk in. But one of the things that we want to show you here is that important aspect. So you see that she starts to insert it. Remember, we talk about those valves. There's lots of valves in the hand. So you can see that right in here, she gets to the point where she's going to insert it, and there's just something butting up against that IV catheter, and it's most likely a valve. And what happens is the vein essentially blows. This is a problem. And again, remember, we've got a lot of branches. We've got a lot of non-straight veins. We've got a lot of these valves in here, and it's just going to happen. But this is what you're going to see for these patients. You're going to see that it just gets occluded, and it's not going to be successful. And this is just a challenge. it's a something that needs to be brought to your practical attention for these types of patients. Now let's talk about the forearm IV insertion. This is a really, really good opportunity for you to be successful, especially in the bariatric patient. One of the things you want to remember is start low. Remember where this is a hand, right? Fine, poorly drawn hand. Hey, stay away from the wrist. We want to get away from here. So you could start just above this, the distal end of the radius ulna. So remember, start there and then start to work your way up. If you start really high and let's say you go for the cephalic vein, which typically runs right alongside the thumb, and this is the big vein, and if for whatever reason you blow that one, it may not be as successful up. If you blow it really high, anything that you're infusing down here won't be able to travel up. So always start low. You are going to have a greater likelihood of success, but just remember to stay consistent. You want that routine. You want that free throw routine. All right, guys, so let's kind of walk through this. She's applying that tourniquet 10 to 12 centimeters above the IV site, and she's going to use those concentric circles to clean off the IV with areas where the IV is going to go. One tip I want to show you here is you can see that she's actually rotating the stylet inside the catheter. What that's going to do is help to break any sort of seal so that you don't get caught with the stylet in the vein. That way it allows you to push it through. Now she's got all her stuff set. Now I do want to show you guys something. Now you can see this left hand. This is so really important because I'm going to point this out. Is that she's actually using her left index finger and her left thumb, which are both in her non-dominant hand, and she's anchoring this vein down. That keeps the vein from moving side to side and shifting. And then she's got that 10 to 20 degree angle of insertion, which is really important. So let's keep taking a look and see what she does. And I'm going to point out one other thing as we keep going. So she gets it in. Now I want to show you guys something. Now she uses right here this. The end of the IV is actually right in here, but she's using pressure above the IV site. This is called tamponade. And what tamponade does is tamponade applies pressure and keeps blood from flowing down so that you can actually keep your patient from becoming messy with all that blood. And then, so she's applying the pressure. No blood is actually coming out. She got that extension set. She grabs the extension set. She removes the cap. And then what she's going to do is she's going to attach it and get it all set up. Now, don't be afraid. Sometimes your patients are going to be a little bit messy. One thing she does here is she actually pulls back, gets some blood return, and then flushes the IV, and then she's going to secure it. Here, we're using a transparent dressing. And then the other thing you'll notice that she does right after this, she's going to get that transparent dressing applied. Make sure, before you do that, make sure it's clean and dry. But then the other thing that she's going to do, she's going to take this tape. And this tape is used to keep that extension loop from getting snagged on anything. You just create this little loop. And then the last thing you need to do, which is so very important, is to time, date, and initial everything. You want to make sure that all of this stuff is documented in terms of, hey, we got to make sure that this is clean and dry, and this was the last time the dressing was changed. So now let's talk about inserting an IV in the AC. Remember, this AC is the antecubital fossa, and what it is, it's the elbow. It's the one place that we know this is really a favorite place for ED nurses. Is the cephalic vein runs. Let's draw the hand again. The cephalic vein runs just alongside the thumb and goes up, and it branches, and it ends up bifurcating right in the elbow. But the cephalic vein is right there, and then it continues up to the shoulder. The cephalic vein is actually one that continues up to the bicep. Now, this cephalic vein is going to be one of your favorite friends in terms of it's kind of your first go-to. It was always my first go-to, but that's the area you're going to want to look. But remember, you want to educate the patient on not bending that elbow. This is where you're going to get those occlusions. Now, another thing to remember is typically we got that 10 to 20 degree insertion angle. Here it may not work as well because it is a deeper vein at the location of the AC. So you may be looking at something like a 20 to 30 degree insertion. So here's the AC. And again, she's going to anchor that vein down. She's going to insert it. Everything's been cleaned. Now she gets the flush. And then I want to show you guys something real quick. Right here, you can see that typically this the hub of this IV is going to lie just a little bit lower, but remember that's a much deeper vein. So what's going to happen is that insertion angle is actually going to be a lot more steep. So this is almost the direction that she went when she placed that thing. It's going to sit up just a little bit. So don't be surprised. Remember, apply pressure if you need to. Apply that tamponade to keep blood from flowing back, and then you'll get an idea of what that actually looks like. Now, one other trick I want to show you is you can see here, you realize that there's no blood coming back. That doesn't mean that you should give out or pull out. What it means is that you need to be a little bit more persistent, adjust it just slightly, and you could see that what ended up happening was she was able to get it, just flush. You're confident, be confident in where you place that IV, and you're good to go. Now, let's talk about bicep IV insertion. This is a last resort. It's really great for bariatric patients if you can't get anything near the hands or forearms. Another location that's really good for are patients with peripheral edema, because those patients with peripheral edema are going to almost feel like a bariatric patient. A lot of swelling in the hands, you get a lot of swelling in the wrists, sometimes in the forearms. So you can actually shoot for that bicep. It's not great. Sometimes you have to do it without a tourniquet, but this is one thing you want to consider in these patients that have this bad peripheral upper extremity edema. Now, one thing I want you to be mindful of is it can be painful, and this is due to all the innervations. And again, you want to start as low as possible. If you have to start right above the AC, go for it. But if you have to start working your way up, that's great. Another location is also the shoulders. So if you need to, you can go ahead and try those. All right, now remember, some patients are going to get a tourniquet here. That's sometimes effective, sometimes it's not. Especially for the bicep. What she's doing is palpating here. We're going to try to find that vein. Use those concentric circles just to make sure everything's all good to go. And then she's going to use that hand, anchor it down, insert. Now, there's something really important I want you guys to see is that even if you apply tamponade, sometimes it doesn't work. What this patient's pressure is just up a little bit, and what happens is it's going to be a little bit messy, and that's okay. You can't go for perfection. What we're wanting is we want our patients to be safe. We want them to get a solid IV in. We want those IVs to be patent, but one thing that we can't focus on is not getting blood. So prepare. You can also see that these Chucks pads are here. These things are really, really helpful, and especially in keeping your patients clean. All right, so let's recap. IV insertion in bariatric patients, it can be challenging, but remember, use evidence. So we're going to use the right antiseptic, we're going to use the right setup, we're going to use the right IV, and also create those good habits. We want to create that routine just like we're going up for free throws. Now, avoid hands. We want to avoid hands because the veins have they're branched. There's a lot of valves. There's a lot of excessive tissue. We also want to make sure that those catheters aren't ending in those joints. That's going to create a lot of problems, some occlusions. The patient's not going to get all the medications they need. They're not going to get the fluids they need. So try to avoid those as much as possible. Start distal, which also means to start low. We want to give ourselves the opportunity, if we miss, to go a little bit higher. And for patients that have that thicker skin, excessive tissue, go bigger if necessary. Like I said, if you're solid, you can hit this 20 gauge and you think you might be able to hit an 18 gauge. If that 18 gauge is going to offer more stability, go with that 18 gauge and be confident. Remember, forearms and ACs are going to be greater in terms of having you be able to set those IVs successfully. All right, guys, I hope that this lesson has been extremely helpful in providing tips and tricks and even techniques in helping you guys become more successful in getting those IVs in those bariatric patients. We love you guys. Now go out and be your best selves today. And as always, happy nursing.